Welcome to the Elevate Care podcast, the show where healthcare professionals, visionaries, and thought leaders come together to explore the limitless possibilities of healthcare innovation. I'm Nishan Sivathasan, your host for today's episode, with Paola Buitrago, Vice President, Workforce Optimization at Emory Healthcare. Well, welcome to the show.
Thank you so much. Thank you and your team for having me here. I'm excited about our conversation.
Me too. I'm glad to have you here. I know you run workforce optimization at Emory. You want to tell us a little bit about that?
Sure. So I've been at Emory for a little bit over 2 years,
Okay.
and I am responsible for our workforce contingency strategy and optimization. So we have contract labor, all of our float teams, we have our staffing and scheduling office, as well as data analytics and budgeting for our nursing enterprise.
Okay. Wow. It's a much larger scope than I anticipated, but very exciting too, I'm sure. You want to share with our listeners a little bit about your journey, how you started off your career to sort of lead to where you are today?
Sure, I'll be happy to. So, my professional journey actually started at Emory University Hospital.
Okay.
I was in nursing school at that time at Emory University, and I had two jobs, which are really, when I think about this now, I think they were some of the most forming jobs I ever had. So, one of them, I was a biologist and I worked at the research floor. We called it the research floor. We were doing sickle cell anemia research. And it was incredible because not only was I able to do research, I was able to interact with the patients. So it taught me a lot about what the PCTs do today, right? Vital signs, that type of interaction. I was in nursing school, but I wasn't allowed to do a lot of the things. So it was about 3 times a week I was, back in the research lab, and the other 2 days I was with patients. So actually seeing what our research was doing for these patients, and I don't know if you know anything about sickle cell anemia, but this is a very chronic illness that affects, a lot of our population down in the South. So it was, truly an incredible experience.
Wow.
And then the second job I had was at the Carter Center, and completely different experience, but it was really incredible. I learned a lot about all of the geopolitical
Sure.
complexity that exists in global health, in preventive medicine, in diplomacy. I was lucky enough to meet President Carter and his wife.
Oh, wow.
Yeah, this was, and of course, all of this was over 20 years ago.
Okay.
So the work environment, the healthcare space was in a very, very different environment. And so that was really, really neat. I served as a translator for many of their conferences.
Okay.
I helped them with organizing a lot of their operations in terms of global health initiatives, preventive health. So in the meantime, I held these two jobs while I was in nursing school, and I was having all kinds of experiences before I even graduated.
Sure.
So, extremely forming, like I said at the beginning. So, from there, I graduated nursing school and went to a completely different healthcare system in Georgia, and another amazing healthcare system. And that's where I held lots of different leadership and operations roles throughout the last 20 years. And during that time, I really found my passion in overseeing systems so that our frontline personnel can really work with a lot of our support. So I went through a master's program and eventually a PhD in industrial and organizational psychology.
Oh, wow.
And I left that healthcare system where I was about 20 years and went to Emory, like I said, 2.5 years ago.
Wow. That's terrific. So just a good wide breadth of experiences that, engaging with the patients directly, the clinical research piece, and just operations. And I guess that translates very nicely and cleanly to what you're doing today.
Mhm.
So talk to me. I think workforce has certainly been at the forefront, top of mind for a lot of healthcare systems out there. And I think Emory in particular has been I would say at the front of the curve in terms of how you've thought about things. Can you care to share with our listeners some of your strategies or thought processes that go into how you run the operations today?
Sure, sure. So we've been very lucky to have been in a journey due to some leadership changes at Emory Healthcare. We have a wonderful CEO, Dr. Lee, and a wonderful CHRO, Rock Anderson, that has really helped us navigate through this very, very difficult workforce environment. And two of the things that we have been really concentrated on are one is our compensation structure. So we
Okay.
really want it to be a place where people came but felt very comfortable with their compensation structure. So we have invested millions of dollars into our frontline to kind of have that as a basis,
Sure.
right? If you think of Maslow's pyramid, we
Yeah.
need that first. And so
Hierarchy of
we've
needs. Yeah.
exactly, we've invested in that significantly. And then number 2, we're really focusing on retention. And of course, that brings a multifaceted approach, right? We want to make sure we have the right people at the right place doing the right type of job,
Sure.
and especially the job that they want to be doing. So we are concentrated on engagement surveys and really looking at trust, at leadership, at physical safety, right? 20 years ago, I didn't have to deal with the safety issues that our frontline has to deal with today. So we've invested in physical safety. We have a wonderful wellness program that focuses on psychological safety and all of that to really and truly focus on retention.
Mm.
So that's basically our North Star. We want to move away from just thinking about recruitment and really focus on retention.
Okay. No, terrific. So a lot of focus on just security and safety is kind of what I'm hearing. And
Yes,
so number one is, hey, take care of me in terms of my financial needs. And then two, from a retention engagement standpoint, what's important to me? What do I need? And then how do you build and construct an environment that's conducive for that for your staff?
exactly.
Correct.
Mhm.
Terrific. So talk to me about how you think about workforce more broadly. So I was talking to somebody earlier today, and they were telling me that when you think about the clinical workforce in general, not much has changed over the last 70 years. And so now, especially coming out of COVID, you hear about telehealth, virtual care solutions, and things of that sort. There's also different ways to run and optimize your workforces too, right? With a mix of core, there's contingent, there's internal labor, there's external. Just how do you think about and navigate all that?
That's a great question, and one that we're thinking about on a daily basis, right? Because that's a great point, is that we are today redesigning for the future, right? We have stopped thinking about the past. So we've come from a very tech um, kind of tech has helped the front lines, but it has kept us away from the bedside, right? Our front line spends more time documenting than really interacting with patients.
Sure.
So it's almost like technology has been sort of a burden. And now we're moving into a space where technology might actually help us get closer to the patient. So we're trying to think about that work environment and how to redesign it in a way where it takes the frontline staff back into actual patient care.
Sure.
And that's going to help us, virtual nursing. We have implemented a virtual nursing model that helps us with admissions and discharges. We're looking into ambient listening. We've done a couple of pilots, but not only with physicians, we have now included nursing so that think about a nurse getting into a patient's room and instead of being in front of a computer documenting
Sure.
everything she has done or will do, she's actually having a conversation with the patient, and ambient listening is taking care of the documentation. So we're doing a lot of experimenting. We really want to be at the front of this. We don't want to be told what's the new greatest thing. Emory is really good at doing research, being innovative, and listening to the front line, right? They're not just sitting there waiting for us to tell us what to do. They are really wanting to be part of the change. So we're really looking at several different things that can ultimately aid the frontline clinicians in spending more time with the patient to then hopefully improve patient outcomes.
Yeah, what I'm hearing from you a lot is a lot of focus on listening and empathy in patient outcomes. So, how, if at all, do you co-create some of these workforce strategies with your clinical workforce? Just how much say do they have in it, and just what's that feedback loop or process look like for you?
So for us, it's really part of the culture.
Okay.
Emory is a magnet facility. Most of our
Mm,
hospitals have been magnet designated. So it is part of our culture to listen, to involve professional government governance, and anything we're doing, we are including the frontline. It actually, most of the ideas have come from them.
oh, terrific.
And so that's really it's kind of like our North Star in terms of what type of organization we wanna be, and, like, the engagement surveys I was talking about, we do them frequently, we don't just do them once a year, and that is the premise is our intention is that we are here co-creating the work environment with them.
No, I love that you focus so much on the engagement survey because at the end of the day, it's about engagement plus outcomes. If you have outcomes and no engagement, it's not sustainable, right? If you have engagement and no outcomes, you're just having a party that's going to run out. So
Right.
it's really important that you focus on doing both. But as you're leading your system through so much change, how do you strike the right balance of leading and guiding your teams through change, through the constant evolution of how you think about workforce and how work gets done?
Mhm. I think, what really matters is that North Star, which is our culture.
Mm,
Right? Because we have all accepted that we're going to go through more and more periods of change.
sure,
And so to do that, we all know that no one follows a process during crisis, right? We all follow a leader. So that leadership development is crucial to
sure.
us. So I would say three things: leadership development, our culture, which is our North Star, and then making sure that you're closing the loop, right? Through those listening sessions.
Sure.
It's not a one-time done deal. It's a truly a listening session on a day-to-day basis. I'll be curious to know how some of your other partners are dealing through this change.
Yeah, I think it's different for everybody, right? They're all at different sizes and scales and points of their journey. You have your larger systems that have significant capital. They're willing to make heavier investments, be it in technology, in their workforce. And then you have others that need to be a little bit more nimble. And so they're trying to use solutions such as virtual care as a way to extend their clinicians' time in the workforce. So they're finding it's a way to actually alleviate burnout. And so it might be, hey, Monday, Tuesday, you're by the bedside. Maybe Wednesday, Thursday, you're virtual. And then Friday is an option sort of day. So I think it's different for each one. I think one of the things I really love and appreciate about healthcare is when one system solves it, you all are so great about sharing it with everybody
Mhm.
else, right? And it's something that's very unique and special about the healthcare space, but that I've found to be very, very interesting.
Mhm. That's so true. We really manage expectations with best practices and share and trial them out because you're right. We can all be very different and be at very different points at certain times, but best practices work out everywhere.
Absolutely. So when you think about technology that you use for your teams, and you said it earlier best, I think like there's a piece where when you use technology, sometimes it creates more work than it actually solves. And so as you go through selection criteria for different technology vendors you choose to work with across the Emory system, is there a set of criteria or are there things that certain technology vendors do that really stand out to you and your team? Maybe it's about listening to your staff in solving for your needs versus sort of what they're able to do out of a box?
Right, and that's another great question that we were just talking about with one of your team members, and I would say that the number one thing we think about and look at when we are having a conversation about any sort of technology or tool that we're bringing into the healthcare system is one, did you have frontline people co-create or develop this tool or technology,
Got it.
right? Were we part of that process? And number two is, are you bringing in efficiency? Are you removing friction, right? Or do we have a tool that we now have to work with another tool
Sure.
and increase that amount of really inefficiency for the team member? So we're always thinking back at the end user. And was that end user involved? Was their world reviewed, right? Because you would be shocked and surprised that we hear about all sorts of technology companies, now AI created companies that have never worked in a healthcare environment, right? That just want to translate technology into healthcare. And I know that a lot of industries think that we say we're so different, but the fact is we are. We are dealing with humans and we are caring for patients. So we are different and our involvement is crucial in that step. So we're always thinking about how involved was the front line, and then are we actually going to make this efficient for the front line? Otherwise, we'll go back into the EMR mess that we have all encountered, which is we placed physicians and nurses, back into a technology space where they are really away from the patient
Right.
because they're documenting.
It creates a disconnection. It's actually interesting. So before I joined AMN, every other industry I've been a part of has not been healthcare, but my wife's a physician, and she would spend hours in her EMR system. And I would tell her over, I was like, "You're doing something wrong. There's no reason somebody should spend that much time in there, right?" And then after a couple of years here, I was sort of like, "Okay, I get it." Right. To your point, there are nuances to the space. There are differences in, having a clinical mindset, or at least appreciating the clinical process and infusing that into the technology solution that's built actually yields a very different outcome that can be very powerful. So I
Right.
know one system in particular, they were cross training clinicians with technologists. So specifically, we talked about virtual care solutions. They actually taught nurses about concepts such as packet loss.
Mm,
And so now that the nurse understood that, they were actually able to contribute to the new solution in a very unique and interesting, special way, right? So it's almost like, how do you understand a broader piece of the entire system and process? And that allows you to bring your perspective in a way that's unique and different to solve for, a key outcome.
right.
So let's talk about workforce, backing up there a little bit, just given kind of that's your key area of focus today. Um, so it sounds like you've been through a lot of change and transformation with your core staff. As you think about where you are today at Emory and your journey, what do you anticipate as being next for your system to unlock further gains or efficiencies?
So we've been on a journey to really diversify, right? If you think about our workforce staffing sources as a pyramid, right? And our core being that really larger part of the pyramid, we wanted to ensure that the contingency part is not only the lesser of the percentage, but it's also diversified. So we did a really nice job increasing the amount of float staff people that Emory hires into full-time positions.
Okay,
So
great.
they are truly Emory employees, but work in a contingency type of space. We have over 690 at this point.
Wow.
And they're not only nurses, they're surgical techs, respiratory therapists, all kinds of frontline team members that are now part of that diversification of the pyramid. So we continue to look at it from that perspective. How diverse are we? Do we have all sorts of skill sets, right? Do we have all sorts of FTE counts, full time, PRN, part time? We look at everything in terms of workforce as how diverse can I be in this space? Because it's really almost a menu of options
Sure.
for the clinician. I can truly be wherever I want to be. I can work wherever I want to work. I can work the hours I want to work. And then we are really focusing on upskilling. So I'm an ED nurse that has, always wanted to be an ED nurse. How will you get me to the ED? And so we've made it really easy and seamless for the clinicians to be upskilled to another role or skill set, which has made it really, really valuable for our organization because it really reduces the dependency on anything coming from the outside.
Sure. No, I love it. It's almost like you have a concept of a total career. So it's almost like you want to take the nurse from the minute they graduate all the way up until retirement, right? And as their journey or life changes, what are the different solutions or options you have for them to still make it, work meaningful and relevant while they can also participate in whatever it is that's important to them personally. Does that sound fair?
It's exactly right. Because if you think about it, we all have those experiences and those
Sure.
moments in life where whatever we're doing is not working. Why do you have to leave that organization? Emory Healthcare is the type of organization that makes it easy for you to stay. And that means that we will invest in you, right? Becoming an ED nurse is not easy. It's highly specialized. And then for us to train you and develop you into an ICU nurse, that's a that's a very heavy lift. But we do it because we want you to be where you want to be. We want you to have the type of work and role that's joyful and meaningful in your life. And we are invested in each of our team members. That's the only thing that matters to us, really, not
Mm.
what you want to do in 2 years or 3 years. So long gone is that notion that we are afraid of losing people from our specific department. We want to see them grow. And if it's not here, if it is at another OU, at another facility, we want to see that process happen.
Wow. Your commitment to your workforce just goes beyond some of those core based security features, but it's more of a partnership, right? We're in this together is kind of what I'm hearing from you. And you're almost bringing down the walls of a traditional thinking of work, which was contingent perm, to there's this concept of workforce liquidity, right? Here's your skill set. Here's what you're able to do. Here's the work that needs to get done. How do we structure things to give you that flexibility? And it's almost like you take on that complexity to figure out how to make it work. Is that
That's it. That's
okay?
100%. You couldn't have said it any better. Our role is to be that system orchestrator,
Hmm.
right? So I I have to orchestrate with HR, finance, where are the FTEs coming
Sure.
from, right? But the ultimate scenario is to make sure that we have a clinician that is looking forward to going to work, wherever that is, at whatever time in their life, and ultimately is going to give better care, and the patient is going to receive better care and have better outcomes overall.
Yeah, I mean, that's the secret. There's an old model, the service profit chain, which is, happy team members creates happy clients, in your case, patients, which leads to a long-term sustainable, system.
Mhm.
So take care of your people. That's where it all starts, right?
Yes.
You talked about culture being your North Star. There's all
Yes.
the comp piece, and then it's really engagement and commitment. It's pretty special. And then you're taking on all that complexity. It's almost like the equivalent of an Apple product, right? So it's very simple and easy to use, which is likely what your workforce feels. But it's actually really complex. If you dig in
Mhm.
there and untangle that,
Mhm.
there's
Mhm.
a lot going on. So it's pretty special. Congratulations to you.
Thank you. Thank you. And you make a great point in terms of systems in general, right? I saw it as a researcher, when I was dealing with data slides and all of the things I was doing in the lab. When those didn't translate to the patient I took care of the next day, it was almost like everything I had done in the lab was for nothing. And it's because our systems didn't work, right? It happened at the Carter Center.
Sure.
You can have the best of intentions at a global scale, but if the geopolitical complexity is higher than what you're trying to do within the system, then it ends up not working. And I saw it as a clinician, right? We would have really chaotic shifts where I would stop in the middle of the hallway and you're thinking, how am I going to get out of this?
Right.
And so I think all we're trying to do is to support that clinician in terms of what's happening around them so that they don't feel that burden and all of that responsibility going to just one person.
Yeah. That's pretty special. So you mentioned AI earlier. Technology is always innovating. It never stops. And sometimes it's helpful and sometimes it's I'll say messy.
Mhm.
But what would you see as next, right? So there's a lot of talk and discussion about AI, optimizing workforces, and I know health systems are under tremendous financial pressure in today's environment. So how do you all navigate sort of the current day and then, think about what's next and sort of the new technologies that are emerging?
Mhm. So, Emory is an academic healthcare system, extremely innovative, research based, and we are looking at the future in a very optimistic way.
Mm,
Number one of our culture North Star priorities is that we want to lead change.
mm.
We want to be part of that change. So we're not just receivers, we're not just going to be the consumers. We want to be those creators. And so a lot of this is happening at the university level, within our digital space, within healthcare. This is why we're piloting ambient listening with our nurses. So very optimistic about the future. And really, we talk about this all the time. Our CNE, Dr. Pappas, always reminds us that truthfully, anything we look at on a daily basis regarding AI, any sort of technology, has to have the answer to the question around how will the human, right, be closer to the human,
Oh, wow.
right? How will this technology or AI put us back closer to the human? And what is that value proposition? If we cannot answer that very comfortable, if we cannot answer that quickly, then we are asked to step back. But number one is, how do we decrease the burden of the frontline? How do we create efficiency, but not just for efficiency's sake, but to answer the question, how will the human get closer to the human?
No, I love that. Lead with touch, not tech.
Yes.
Well, terrific. Well, I appreciate you stopping by today, Paola. This was a great conversation, and I'm sure our listeners benefited greatly.
Thank you. Thank you again. This has been lovely.
Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.